All right, let's try it again. Hey, hey, hey. So, this topic today is bonnets, PJs, and slippers. Does your doctor care? Does it really affect your health? And we're also going to talk about some other medical office etiquette that you can absolutely use so that you can maximize your doctor's visit. Now, this topic was one of those that it was spicy. I'm not going to sugarcoat it. This was one of those topics. There was a lot of back and forth. Who is right? Who is wrong? And I said, you know what? I should go ahead and talk about this officially because I've talked about it in private with a few people when this first came out. And I said, well, I'm going to address it and address it today. So, if you are new here, thank you, welcome, hello. I'm Dr. Ashley Booth. I'm a board certified family medicine physician, and I provide health tips and tools that you can use in your everyday life. Because what I understand is that your life ultimately affects your health. I want to go ahead and get started, but before I do, if you have not subscribed and followed, go ahead and do that because you don't want to miss any other content that we put out. Also, if you are watching, go ahead and put in the chat. Tell me where you're watching from. Tell me who you are. I would love to say hello. And I also want you to chime the chat today because we're going to be interactive today. I want to know your thoughts so that we can have this conversation because this conversation has been had by a lot of people. And I also want to know what you think. Also, share this so that everybody can know what we're talking about and so they don't miss out either because sharing is caring. Now, let's get into it. The backstory of this is that a doctor posted in their office no bonnets, PJs, or slippers. If you have that, they will reschedule your appointment, and that was the office policy going forward. What happened is they had one of their patients take a picture of it, post it on social media, and say, I am so happy that my doctor is now putting this into practice. Well, they thought they were going to get a lot of people say, yes, that is awesome. But they also got quite a few people that were like, say what now? Mm-mm. So a lot of people were going back and forth on it. And what I was starting to see in those arguments for the people who said, yes, you should absolutely be allowed to wear that, the bonnets, the PJs, the slippers, you should be able to do it because one, I don't feel well. When I don't feel well, I want to wear something that is comfortable. It's total. So it's one of the other ones was some people said, well, I have a disability. And this is the most comfortable thing that I can wear. It's the easiest thing that I can put on to get to the doctor's office because I have a lot of issues of being able to get there. So that's one of the reasons. The other one was people just say, you know what? You shouldn't judge me, especially not my healthcare provider. I can wear what I want, period, point blank. That's it, the end, right? And so I was like, oh, okay. Again, very spicy. Hello, Miss Diane. I see you. Thank you for tuning in. So they were like, you shouldn't judge me, especially not my healthcare provider, because they took an oath, right? So if you took an oath, that means that you should not do that. Okay. Then there are people who were against it and they said, you know what? There are some other comfortable clothes that you can wear outside of PJs. And they said the other thing is when you go out, you should look presentable. When that hit, woo, the people are like, hold up now. You don't tell me what to do. That is judgmental. You're being elitist. Then the other side said, well, maybe you were to it. It also could be predestined. So there was a lot of back and forth between a lot of people. But at the end of the day, what does your doctor think about it? Was that one doctor's opinion? Or was that like the consensus? And a lot of us think about that, think that same way. Like, what exactly is it? Let me give you my 2 cents on today. For me, I can see both sides. As a patient, me being an actual patient, and as a physician treating patients. So, as a patient, I understand the standpoint of wanting to be comfortable. And let me tell you what happened. I had to go to the dentist office not my favorite place to go. And I see why when patients come see me, they're like, I'm not really happy to see you. I get it. I understand because when I go to my dentist office, if they find something, especially a cavity, I'm like, this is not the happiest place for me. So I had to have a cavity done, filled, whatever. But I will preface this, it was an old cavity. It had served me well for a long time, but they had to go back and redo it. Not happy either way. I hate that anxious. I don't like it. So when I went to my appointment, the lady said, would you like a blanket? And before I was like, cold, but I was like, blanket either. I felt it and I immediately, if it was literally a security blanket, I felt more comfortable. I felt more relaxed. It was cozy. It was soft. And I was like, okay. And it made that experience a lot more enjoyable. So I get the comfort side of it. As a physician, what I want you guys to understand is that as a physician, I understand when I went along this journey that physicians are people, people with experiences, people who went into a profession that is very rigorous, that is very esteemed, that has traveled and gone along the way of societal norms. And what I mean is that when society said things were okay, then it seemed like medicine and physician groups started to catch up and say, okay, yeah, you're right. That's okay. It's taken us a while to get more progressive because it's very structured and this is the way that things are. As far as medical advancements and the technology, it's like, yes, this is, we should change it and think and forward thinking on that. But some of the other things, I don't know. Let me give you an example. Women in medicine, it has taken a long time for medical schools to be almost balanced with the number of men and women in medical classes because for a long time they thought women did not need to be in medicine. Your place is at home. By the time we got into medicine, then they said, well, you know what? Maybe you shouldn't pursue certain fields in medicine because this is a very rigorous field. You may not be at home with your family. This may not be the right fit for you. So women had to break barriers and say, no, I want to do this, and this is how I am going to do it. So once you think about a profession that is set up that way, then you have to think about the people who are also in that profession. There are some young and new who are coming in with fresh ideas and stuff, but you also have some older ones. And then you just think about people are people and what have you been exposed to? And depending on what you have been exposed to, depends on how open your mind is to certain things. And you are either going to approach it with judgment or understanding. That is just people. There's judgment or there's understanding. And I have experienced both in medicine. I had one doctor that I shadowed and was with, and there was judgment. Let me tell you what happened. He saw a patient who had on pajamas and he said, I'm going to give you this medicine, but I don't think you're going to take it because you didn't take the time to be presentable today. You look real lazy, and I think you're going to be lazy with this treatment plan, but I'm going to give you the medicine. The next time you probably want to spruce yourself up a little bit. I was like, oh my gosh. Listen, that was a clutch the pearl moment. Now, again, I am just a medical student at this time. And I was like, well, I can't say anything about this. This man has his own practice. He's been doing this for a long time. A lot of his patients are very loyal, and they would just say, that's how he is. He's a straight shooter. He says what he wants, and that's how it is. You either take it or leave it. So there are some people that I have seen that have done that. Some are just going to come out and they are going to say it and they're going to be very blunt, and you'll say, I'm not going back. There's some people that said, if my doctor treated me like that, I wouldn't go back again. However, I want to caution you and let you know that with that judgment, some of them may not say it. Some people are going to be very upfront. You're going to know what they're saying, and that's it. Some people are going to come in and treat you, they're going to move on, and you will never know how they felt about how that situation was. So just understand that. The other one is understanding. I was on a rotation with another doctor, and we were in the hospital setting, and there was a Black family, and their child was there, and they were going over the the treatment plan. And there was a little bit of resistance from this family about whether or not they can follow this treatment plan. You're in a family that is not going to follow the things. He, after we got on, the only black person on the team at the time. He said, "Do you know what could the hair do?" Caused them to say that they needed to wash their hair. Like I told them, I said, black people do not wash their hair typically that often. We just don't. We have to put certain products in. It's a whole process. You have to put conditioner in, like all this. So I'm walking him through all the steps, and he's like, "Oh," because he wasn't aware. He didn't understand. And especially because this was a girl, this was not a little boy. So he said, "Oh, okay." So once I walked him through that and he wanted to be more understanding about that situation, he said, "Okay, I'll tell you what." And we worked together with the plan on culturally how this family was going to deal with this, but also with their treatment plan and put the two together so they could still get the care that they needed. So as you can see, there's two different ways that you can look at it. And I know I'm talking about doctors, and like I said, doctors are people, and you are people. And when you think about something, how do you approach a situation? Like when you examine something and you look at a situation, you are looking at it with your eyes. Let's just think about it with a plate of food. Before we eat, we look at it and we say, we eat with our eyes. We say whether or not we are going to eat it or if we're not. Now, if you are someone who says, "No, I don't need to look at my food to eat it, I'll just eat it," you can put that in the chat and tell me because I want to know. But if you are one of those who say, "Yeah, I like to look at it. I like to see it. It says, oh, yeah, this looks really good. Like the vegetables look really fresh and crisp. The meat looks tender and juicy and well seasoned. Like all of that's going through your mind. You're like, I can't wait to eat. I don't know about y'all, but me and my little daughter, we have a little dance before we get ready to eat something. And when it's good, like we really get into it. Okay. So we eat with our eyes. My daughter also is one of those who says, something about this ain't right because you have delicious and you have suspicious. And when something looks suspicious to her, she is like, She does this. She puts her hand over her mouth. She takes her other hand and puts it on the plate and she passes it in front of me and says, not doing that. I don't know what this is. And the same thing probably happens for you, especially if you get something and you know what it's supposed to look like. And then you say, that ain't, like somebody put some mac and cheese on your plate and that mac and cheese don't look right. And don't get me started on the potato salad, okay? You see something that you know this is not supposed to be here, that is going to be a problem. And you're probably not going to give it a try. Somebody could say, go ahead and try it. Go ahead. You're probably like, I'm good. Thank you, though. Right? So we all use our eyes and things to look at it. But even though I'm talking about looks, when we look from a physician standpoint, we are looking not to judge you, but this is actually a part of our space on the medical exam. Exactly, facts. That's what happens. That's what we do, right? When we eat, that's exactly it. So when we are looking though from a physician standpoint, this is also on your medical form. When I'm doing an exam, you know what is a line that's on your medical exam? Appearance. Your appearance is actually something that I can evaluate. And on there it says, are they well groomed? Are they unkempt? Are they disheveled? All of those things are on there. And you say, why? Not because I'm judging you, but it also helps me to understand your mental state. What does your mental state look like? It could tell me if you are depressed. Because think about it, someone who goes through a psychotic break, if you've ever known anyone or experienced it or seen it or heard it, one of the first things that goes by the wayside is their personal hygiene and their grooming. That's one of the first thing that goes away. And so that can tell me, okay, are they mentally okay? So it's not just I'm judging you, it is actually something that we can evaluate on the form. But know that this is up for interpretation too, right? Because for one person, they can look at it and say, oh, PJs are clean. And you guys may even have a discussion about it. Oh, this got SpongeBob on there. Oh, those are cute. Da da da. See, that person say no big deal. They're clean, whatever, right? Someone else can look at those pajamas, clean or not, whatever, and they can say, that's lazy. Do they have a mental thing? Do they just not care? Whatever, but that could be going through their mind. So that is an up for interpretation, more of a subjective thing that can go through there. But it actually is something to be aware of. It is on our forms that we can fill out and say what we think. And understand that this can affect you because people are like, well, how does this affect me? Because once you think about how somebody is thinking about something, then that can go into like the treatment plan. And how it goes into the treatment plan is someone will say, well, if we both go in and we have cold symptoms, shouldn't they give us the same treatment? They should. They absolutely should. However, in order for me to get to that diagnosis, I have to ask you questions. And the more questions I ask, the better I am able to be able to figure out what you truly do have. So if someone comes in and they see that and they already have a mental block that says this person doesn't care, they're lazy because I've already assessed them mentally, they're not depressed, they just didn't care today. So they may not care about the treatment plan. Why am I going to care about putting a whole lot of time and energy and trying to figure this out? Because they're probably not even going to put the time and energy into following the treatment plan. Not saying that it is right, not saying that it happens 50 million times, but I'm saying that it is a possibility that this could happen. And people say, well, it's just the doctor's office. What's the big deal? The big deal is this is your health, right? And since we're speaking about health, let's think about this. You have on your PJs, the PJs that you get in your bed with, right? And you say, I'm just going to the doctor's office. The doctor's office, they have those sick people because you sick too, right? Probably sick. That's one of the reasons why, because people say, I don't feel good. So you probably don't feel well. So you're sick. So, sickness means there's probably some germs because you are coming to the doctor's office, and more likely than not, you're going to have more sick people at the doctor's office than you're going to have anywhere else because that's where a lot of people come when they don't feel well. And that's fine. But when you have those germs got on you and they got on those PJs. And now those PJs are going to travel back to you in your house and get back into your bed. And you may end up sicker than when you went in. I have a lot of parents that say that about the doctor's office with their kids because they say, I brought a well child in there, but then 3 days later, now they sick. So I think they must have picked it up at the doctor's office. It's probably, especially if those kids over there licking on those sick kids' toys. So you have to be, mindful about that. Now some offices are doing a good job of well side and the sick side so they can try to mitigate that. But just know that that also literally can affect your health because you are taking those germs and literally putting them in the bed with you. So if you want to be comfortable, there's nothing wrong with that. Put some other comfortable clothes on, find what makes sense to you, and then you go ahead and go to the doctor's office in it. I know a lot of people say, when I get back home, I'm getting in the bed. Get in the bed. But you take those clothes off, put your PJs back on, get comfortable back in the bed, not transferred any germs anywhere. I hope that makes sense for you. And the other piece, I'm telling you guys, there's a lot of layers to this one when I was thinking about and looking at it. The other piece was when I had stitched my video with the other young lady, was she had said, this doctor is advocating for you. And I was like, that's interesting. Because I'm all about advocacy. And I was like, how did she say that? And then I thought about it. I was like, she's absolutely right because this doctor may have said something that people did not like, but at the end of the day, she's telling you something that you probably need to know because she is advocating for you and let you know, hey, you could go out there like that, but I'm telling you, this is probably not going to be a good idea. And this is a way for you to advocate for yourself because it is a non-verbal, because a lot of people say, well, I don't know how to say the things, I don't know, whatever. This is at least a non-verbal way to say that you are engaged, that you care about your care, that you want to know what is going on, and that you are going to be a participant in your care. It says, I am ready to receive whatever it is that I'm supposed to receive. It just says that you have that energy about yourself. Whether you like it or not, that is one way that you truly can advocate for yourself. So I know we've talked a lot about that part of it. The other thing that I want to touch on real quick is some other things that you can think about beyond your appearance just for some etiquette stuff that all of your doctors would appreciate, no matter which side of the fence they are on. I know I would appreciate it, and I know everybody else is. And it's some of the things I've talked about before, such as filling out your paperwork before you go, because that helps with the flow of everything. It doesn't hold anything down, it doesn't make the office run slower, especially if they give it to you beforehand. The other one is be early, because if they don't give you paperwork beforehand, I promise you there's something that you're going to have to sign or fill out before you get there, even if it's verified insurance, whatever. The other is be prepared. Know at least the basics, your medication and your medical history. What do you know? What have you been diagnosed with? What medicines are you currently taking, and medicines you should be taking or you have taken in the past? Prescription or non prescription. Okay. The biggest one, the next one, silence your phone. Let me say that one more time. Silence your phone. I have to be very clear about that. That was like a huge big one. And vibrate is not silent. Vibrate vibrate is not silent. That is still a distraction. When you are in there and you're trying to talk to your doctor and you keep getting these buzzes, and then not only do you get the buzz, you don't ever stop the buzz from buzzing, and you just let it keep zzz, 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 and it keeps doing that. That is very distracting. And you are trying to listen, I'm trying to talk, you're trying to talk, I'm trying to listen, and it just throws everything off. You keep looking at your phone. Oh, who is this calling now? Who is this calling? It's just very distracting. The other silence of your phone is on your latest, because it can be distracting when you're in the lobby with other patients, when you're waiting in the exam room. I've had some people, the volume is so loud and it can be distracting. Think about it. If you may be coming in, you're well, you're just coming in for your checkup, regular checkup, but someone else may not be feeling well. So that loud noise could really be a distraction to them. So get the earbuds, go old school and have them with the cord. I don't care. But find some way to keep that for you. If you left your earbuds or whatever, see if that show has some caption or something. But please silence it so that everybody else can have a good visit. And that goes along with my next point, which is just being kind and courteous and respectful, because this visit is not just about you, it's about everybody else around you and that office culture. So then it just keeps everything together for everybody. And the last one is just being engaged with your care, making sure that you're following up, you're asking the questions, you're talking to them so that they can ultimately do what they need to do for you. So I, I know it was a lot today. That is not the point of this today. The point is for you to be informed and aware of some things that could potentially happen. And it is just up to you to decide what you want to do, because at the end of the day, you want to have, you want, that's the reason why you get involved and do all this stuff anyways, because you want to feel better. So, and I want you to. So let's keep this discussion going. I know a few people chimed in today. Even as you watch it later or whatever, leave me some comments about what you thought today. You can also send information about upcoming show ideas, all that kind of stuff, because I just want to know what you guys are thinking and what makes the most sense for you. And until next time, I will see you soon. Take care.